Hi, my name is Katie Lester, and I did my presentation on herpes. So, what is herpes? So herpes is a DNA-enveloped virus that is usually associated with cold sores and sexually transmitted infection. There are over 100 different types of herpes viruses, and they are very common and can very easily infect their hosts. All herpes viruses have the same morphology, replication, and latency cycle. And latency cycle is what makes herpes virus family an important pathogen because it can have the ability to travel through a population silently. And 9 of the herpes viruses can infect humans. However, only 8 of these humans are the natural reservoir for. So, herpes viruses have a unique 4-layered structure, a core containing the large double-stranded DNA genome, which is enclosed by an icosapentahedral capsid, which is composed by capsomeres. And so the capsid is surrounded by an amorphous protein coat called the tegument, and loosely surrounding the capsid and tegument is a lipid bilayer envelope derived of host cell membrane. And the envelope consists of polyamines, lipids, and glycoproteins, and these glycoproteins confer distinctive properties to each virus and provide unique antigens for which the host is capable of responding. So here are some examples of what the virus looks like using electron microscopy. So the virus that can affect humans falls under the family Herpes viridae. So there are 3 subfamilies of this family: the alpha subfamily, the beta subfamily, and the gamma subfamily. So we'll be focusing on the Herpes Simplex viruses today. So in the alpha subfamily, we have Herpes Simplex virus 1, Herpes Simplex virus 2, and then varicella zoster virus. Varicella zoster virus is also known as human herpes virus 3 and is associated with and is the causative agent for chickenpox. And so the members of the alpha subfamily are characterized by extremely short replication cycles, prompt destruction of host cells, and the ability to replicate in a wide variety of host tissue. So again, HSV1 and HSV2 is what we'll be focusing on. So these 2 viruses only share about 50% of DNA homology. However, they share a lot of the same characteristics. For example, the primary target cell they infect is the mucoepithelial cells, and then their area of latency is in the neurons. However, where they infect is different. So usually HSV1 is associated with infecting above the waist and is referred to as oral herpes. And then HSV2 is more commonly infects below the waist and it's referred to as genital herpes. However, they are not limited to these locations and they can infect either locations, but this is what they're more commonly associated with. And so HSV is often a recurrent disease, but it's not terribly dangerous unless we're talking about infection of the brain or the eye. And when herpes infects the brain or the eyes, this can have significant morbidity and mortality. So herpes simplex viruses are most contagious when herpetic lesions are present, and the virus can be spread through asymptomatic or symptomatic viral shedding. And herpes can be in the saliva and genital secretions even when there are no herpetic lesions seen. And so for HSV1, typically we see it can be spread through the saliva, kissing, and skin-to-skin contact. So contact also with saliva through sharing toothbrushes, and contact with broken skin can cause HSV1. And then HSV1 can also cause genital herpes if the genitals are exposed to fever blisters or sores on the mouth or the face through oral sex. And then for HSV2, this is spread through skin-to-skin contact or sexual intercourse of all types, such as oral, vaginal, and anal. And then HSV2 can also pass from mother to infant. And so when the baby is passing through the infected birth canal, comes in contact with infected vaginal secretions during delivery is when most of the transmission happens, and this is known as neonatal herpes. And then transmission commonly occurs from contact with an infected person who does not have visible herpetic lesions and who may not know that he or she has the virus. So it is very common to see asymptomatic transmission. So pathogenesis of herpes can be part of the lytic or the latent cycle. So herpes will land in a susceptible host and bind to epithelial cell receptors, triggering the cells to internalize the virus. And once the virus is inside the cell, it begins the lytic cycle, where DNA is transcribed and translated by cellular enzymes to help form viral proteins that are packaged into new virions. And then the replicated herpes virus is able to exit the cell and infect nearby epithelial cells. And so HSV1 and HSV2 can also infect sensory neurons. And so once in the body, the virus will travel up the axon of the cell body to start the latency cycle. The sensory neurons of the face have their cell bodies in the trigeminal ganglia, and the ones around the genitals are located in the sacral ganglia. And so the virus settles for life in the neurons, and because the sensory neurons are not destroyed like epithelial cells, herpes can reside in the sensory neurons permanently. And so the virus can be reactivated to make viral copies of itself and send those back down the axon to be released to infect epithelial cells. So once it's in the sensory neurons, it stays there forever. So as discussed before, immune system evasion is a very important aspect of this virus. So since herpes viruses are able to go latent, they can hide from the immune system for decades. And since the virus has a latency cycle, cell-mediated immunity is important in controlling herpes viruses and viral infection. So to evade the immune system, they have proteins that appear like our MHC1 molecules, but it's really not. And so it convinces a cell that it has an MHC1 molecule and therefore should not be killed by natural killer cells or CD8 positive T cells. And so the virus also has a way of inhibiting proliferation of cells. So they produce this pseudo IL-10, and IL-10 is an immunosuppressive cytokine, and the herpes virus is able to produce this pseudo IL-10 and convince local areas that the body does not need to attack as much. So herpes is broken down into different stages: the first outbreak and the recurrent outbreak. The first time a person develops herpes, they can have recognizable signs and symptoms, or it can be asymptomatic, and this is referred to as the first outbreak and is usually associated with a longer duration of time, especially if symptoms are seen, and it is associated with increased viral shedding as well. And then soon after the first outbreak, majority of people will have recurrent outbreaks as well. And so these are usually less severe than first outbreaks, and these can also occur asymptomatically. And recurrent outbreaks can be triggered by stress, skin damage, or viral illness. And so once we do see symptoms, the symptoms follow a number of stages. So the first is the prodrome stage, and this is associated with tingling or burning sensation of the infected area. Then blisters will form with small red bumps that fill up with this clear whitish yellow fluid, which you can kind of see in this image here. And then the ulcer stage is blisters will burst and drain, and then develop ulcers, which will ooze fluid. And then the healing stage, so with the first outbreak, when symptoms are seen, the healing stage will take the longest, usually 2 to 4 weeks. And then with subsequent outbreaks, the healing occurs quicker. So most individuals infected with HSV are asymptomatic or have very mild symptoms that can go unnoticed or mistaken for another skin condition. So when symptoms do occur, though, herpetic lesions typically appear as one or more vesicles or small blisters around the genitals, rectum, or the mouth. So these vesicles will break and leave painful ulcers that we talked about before. And so with oral herpes, what we usually see is lesions will appear on the palate, gum, tongue, lip, and facial areas. Oral herpes is usually associated with fever as well, and then enlarged lymph nodes can also be seen with oral herpes. And then adults will also sometimes experience pharyngitis as another symptom of oral herpes. And then for general herpes, ulcers and pustules for women will be seen on the labia majora, labia minora, mons pubis, and the vaginal mucosa, as well as the cervix. And then for men, we usually see these ulcers and pustules forming on the shaft of the penis. And then, so patients with HIV, elderly patients, and young patients, as well as pregnant women and their infant, are all patients that are at an increased risk for serious outcomes of the herpes virus infection. So there are a lot of other places that herpes can infect on the body. So herpetic whitlow is the infection of the fingertip or the nail bed. Herpetic gladatorum is infection of the trunk of the head. It is usually associated with wrestlers and rugby players because of the close skin-to-skin contact they have. And then eczema herpeticum is infection of individuals with burn injuries or atopic dermatitis. So these areas of the body can become very infected as well. And then keratoconjunctivitis is the infection of the eye, and herpes will infect both the cornea and conjunctiva. So symptoms include redness, tearing, sensitivity to light, and then one really interesting symptom is the virus will present as a lesion on the cornea, and this lesion appears as branching dendrites, so similar to what we see like with a neuron, the branching structure seen. The lesion on the cornea will appear just like this. And so there's also herpetic meningitis and encephalitis, which is infection of the central nervous system, specifically the temporal lobe. And this can happen in healthy individuals. And herpetic encephalitis is the most common form of sporadic encephalitis in the U.S. And then neonatal herpes, as we discussed before, which is passing from the mother to the infant. So here are some images of what these different infections can look like. So up in the top left, we see eczema herpeticum, and then down below is herpetic gladatorum, infection of that face right there. And then up on the top right, neonatal herpes. And then down below that on the finger, we see herpetic whitlow. And then here's the eye. If you can see that kind of green dendritic lesion there, which is kind of the hallmark symptom of herpetic keratoconjunctivitis. So herpes is usually diagnosed based on how and where the lesions will appear. However, various tests can be performed to confirm the diagnosis. So HSV nucleic acid amplification test, which is NAAT, is the most sensitive and highly specific test available for diagnosing herpes. However, in some settings, viral culture is the only available test. And viral culture is kind of known as the gold standard. However, the sensitivity to viral culture can be low, especially with people who are having recurrent or who have recurrent or healing lesions. And then blood tests can also be taken to test for antibodies as well. And last but not least, we have the treatment. So there is no cure for herpes, and there is no vaccine as well. So a kiss is but a moment, but herpes is forever. So HSV does encode several target enzymes for antiviral drugs, but most of the antiviral drugs are nucleoside analogs. Some of these drugs are acyclovir, valacyclovir, and famciclovir, and these drugs can soothe symptoms, but they do not and prevent outbreaks, but they do not cure. And then, so prevention can be use of condoms, which cannot eliminate, and then abstinence from sexual intercourse is the best form of prevention. And my sources, thank you.